Right now, you have a dietitian in your pocket. At any hour of the day, you can pull out your phone and get a customized meal plan in seconds. Yet, despite this infinite access to automated nutrition, chronic diet-related diseases are still climbing. It is incredibly tempting to rely entirely on artificial intelligence. It promises instant, personalized meal generation and perfect macronutrient calculations without costing a dime. On the other hand, you have traditional nutrition professionals, like registered dietitians. Hiring one requires making appointments, committing your time, and spending real money. This leaves anyone trying to eat better with a very practical dilemma. Is it actually safe and effective to replace a trained clinical professional with a free text prompt? Choosing between AI and a human professional depends on how you allocate trust, a decision driven by your current baseline health. This table breaks down exactly what each side brings to the equation. Artificial intelligence is built for efficiency. It gives you 24/7 availability, immediate answers, and instantly calculates your daily calories and macronutrients for free. Human professionals are built for context. They physically assess your condition, integrate your specific blood work and lab results, and provide the behavioral coaching you need to actually stick with a plan. The core difference here is the final output. When you ask an AI for a meal plan, you receive a mathematical output based on general population averages. It optimizes for numbers. A human dietitian, however, builds a plan for physiological adaptation. Physiological adaptation means the strategy adjusts safely to your specific biology. As your body changes, or as your medications and metabolism shift over time, a human professional modifies the approach to match reality. Confusing a mathematically correct meal plan with a medically safe nutrition strategy is what creates the AI diet illusion. The math might be perfect, but human metabolism rarely follows a strict equation. This chart maps which tasks belong to AI versus a human, based on risk and complexity. In the bottom left, we find the ideal zone for AI, standard maintenance and pure data processing. For hitting daily protein, carbs, and fats, AI handles the math effortlessly. It perfectly tracks micronutrients, summarizes nutrition research, and compares popular diets. It is also the ideal tool for breaking out of a food rut, generating endless recipe ideas tailored exactly to your specific calorie goals. The result is a highly accurate, immediate system for tracking exactly what goes into your body on a daily basis. The trade-off is that the algorithm completely misses your cultural preferences and lifestyle constraints. And if you have a stressful week and fail to stick to the plan, the AI will not step in to course correct. For the healthy, everyday optimizer who just needs to streamline their routine, AI is a flawless, cost-effective calculator, provided you don't require medical context. But if you are managing a diagnosed health condition, you have reached the absolute limit of what AI can safely do. Relying on automation becomes dangerous if you are dealing with type 2 diabetes, chronic kidney disease, severe food allergies, or eating disorders. When you ask a large language model to manage these conditions, you invite a massive mismatch between input and outcome. You will likely receive generic, non-contextual, or hallucinated advice. An AI cannot review lab results, it cannot cross-reference contradictory medications, and it cannot assess physical symptoms. Applying an automated, generalized mathematical model to a complex biological disease introduces severe, and sometimes life-threatening, medical risk. This brings us back to our chart, to map out where registered dietitians and clinical nutritionists become mandatory. In the bottom right, we have complex medical needs, requiring rigorous science. This is medical nutrition therapy. A human professional creates a plan adapted to your specific blood work and disease progression. Then, looking at the top half of the chart, we find tasks requiring behavioral intervention. This applies whether you are healthy or managing a chronic illness. Human experts provide the long-term support necessary for actual success. They adapt your plan when your motivation wanes, when you hit a plateau, or when your life circumstances drastically change. You do have to accept the trade-offs. Working with a professional requires a significantly higher financial investment, the friction of scheduling regular appointments, and the effort it takes to find someone whose coaching style matches your personality. Ultimately, while artificial intelligence manages the math of your food, human professionals manage the reality of human behavior and biology. This flowchart maps out a basic triage system to help you decide exactly which route to take. The very first question to ask yourself is, do you have a diagnosed medical condition like diabetes, chronic kidney disease, or severe allergies? If the answer is yes, you are a medical navigator. Professional clinical oversight is non-negotiable and mandatory for your safety. If the answer is no, you move to the second question. Do you struggle with adherence or the behaviors around eating? If yes, you are a behavior changer. You know what to eat, but you need a human coach to provide the accountability and support to actually do it. If still no, you land on the final path. You are generally healthy with solid habits and just need to track macros or find meal ideas. You are an everyday optimizer. For you, AI tools are the most efficient and cost-effective choice. Identifying your primary personal constraint, whether that constraint is a health diagnosis, your own daily behavior, or just a lack of dinner ideas, dictates the perfect tool for the job. Long-term health requires a strategy that combines automated data tracking with clinical expertise. The optimal strategy is a hybrid ecosystem. You lean on AI for daily, high-frequency tasks, like quickly logging your meals, tracking your exact macros, and generating quick dinner ideas. Then, you take all that pristine, AI-generated data to a registered dietitian for monthly check-ins, allowing them to provide accurate clinical oversight and behavioral adjustments based on hard numbers. The trade-off here is that you have to take the initiative. You must actively manage and sync the data between your automated tracking apps and your human healthcare provider. Artificial intelligence is the ultimate assistant for daily execution, but human professionals remain the ultimate architects for safety, context, and long-term strategy.